Welcome back. With us right now is Dr. Ryan Grover from the Scripps Proton Therapy Center. Welcome, sir. Nice to have you here today.
Good morning.
And first, I'd like to ask, people see the name Scripps, very well-known name.
Yes.
How are you folks affiliated with them? Are you kind of a division of all the Scripps areas that are down? I think they're in La Jolla area, right?
Yeah, absolutely. All through La Jolla, in the San Diego area. And our affiliation is with both the hospital system Scripps and with the Scripps doctors.
Okay.
So the doctors are Scripps doctors, and the employees of the hospital and of the center are Scripps employees, and we work very closely with all the Scripps hospitals.
Oh, very good, because they have an excellent reputation, long-standing reputation for sure. So explain what is proton radiation therapy and what types of cancer is it effective on and appropriate for?
Sure. Yeah, proton therapy is, in a nutshell, it's a very specific type of radiation therapy. And radiation therapy in general is used to treat cancer, sometimes by itself, and sometimes it's used in conjunction with surgery or with chemotherapy.
Okay.
And it can be used to treat almost any part of the body. Radiation can be used to treat cancers pretty much from the head to the toe. And it can be used to treat advanced or early stage tumors.
Okay.
And protons as well. We treat brain tumors, throat tumors, breast tumors, prostate tumors, all of that with protons as well.
And how does proton radiation therapy differ from the standard radiation therapy?
Well, proton is a very specific type of radiation, but most of the time when people hear about radiation therapy, they're hearing about X-ray radiation therapy. X-rays are very commonly available, so that's kind of the bread and butter of treatment throughout the radiation field. Protons have some very specific advantages, though. When you're treating a cancer with X-rays, the X-ray beam will go in through the patient, in through the tumor, treating the tumor, and then on out the other side. So it really is radiating everything in its path.
Okay.
Even though the radiation can be focused around the tumor, which is one of the great things about modern X-rays. Protons take it a step further, and the radiation from protons will enter the patient, and then it will actually stop when it gets to the tumor. So it unloads its radiation in the tumor without exiting out the other side.
Okay.
So the great thing about that is it allows us to give the same dose of radiation to the tumor without giving radiation to the stuff behind it. Or if you're using multiple proton beams, you're just decreasing the radiation dose to everything around the tumor.
Okay, so it's more directive then, or pinpoint, I should say.
Yeah.
And as far as the quality of life during treatment, I mean, we often hear of radiation therapy, chemotherapy, the people, among other things, just feel very, very down and lethargic and so on. So how does this differ?
Yeah, well, the treatments, whether you're talking actually about surgery or chemo or radiation, the effects really depend on what part of the body you're treating and what cancers. And with proton therapy, probably the most common cancer we see is prostate cancer. And in gentlemen with prostate cancer, the treatment's very, very well tolerated. They're able to continue with working at their jobs usually, or working outside of the house, playing with their children, their grandchildren, playing golf, being active outside. So there's really no limitations that we impose on those patients. But across the board, the difference in side effects really depends on what part of the body that you're treating. Okay.
And as far as insurance goes, is this covered?
Well, proton therapy has been available for decades, and usually and predominantly at major medical centers. It's a very complex treatment, but Medicare recognizes that it's not experimental, and it's been covered by Medicare for 25 years, actually more than 25 years. The private insurers are a little different because they're constantly changing, what they cover and in who. So it's a little hard. I can't, give a broad statement on the private because they may list protons as covered, but when you really talk to them about it, you can argue for why it should be covered for specific cases.
Okay.
Yeah, and as a physician, we talk to them all the time about that, and we have a team of people helping us with that as well.
Now, as far as the Scripps Center, what makes it unique is there's probably other centers throughout the United States, although, as I said earlier, Scripps has just a wonderful reputation.
Yeah, they do. And that's one of the reasons it's great to work there. The other thing that's great about the Scripps Proton Center specifically is that it's one of the only centers that has pencil beam scanning in all 5 of the rooms. So we have 5 treatment rooms for patients All of them have the most advanced form of proton technology.
When you mean pencil beam, very direct? Okay.
Yeah, the pencil beam is basically, it's a small beam analogous to a pencil that's controlled by a magnet. So that magnet will move that pencil up or down or right or left, scanning it through the patient. So we can really direct it to where the tumor is and build a radiation cloud around the tumor, and that cloud can be very, very complicated shape because we can direct the radiation exactly where it needs to go with lower entrance dose and without the dose coming out the other side.
Very good. Now, as far as the treatment time goes, I guess it would just vary depending on the tumor where it's located. Would it take less time using proton radiation therapy than standard radiation therapy, or it just totally depends?
Yeah, that's a great question. It really depends on the patient, as a lot of things do. The actual delivery of protons is very, very quick. It can be, the radiation can be delivered in as short as 30 seconds or a minute.
Wow, okay.
But most of the time, and this is true with all kinds of radiation, most of the time is spent setting the patient up. Because we have to be very, very exact and very precise. So we'll take pictures before the treatment, be sure we're right on target, and all that can take sometimes 5, 10, or even 15 minutes of prep time.
Okay, but in reality, that's nothing. I mean, 15 minutes of prep time and then a minute maybe of the actual treatment. That's a tiny amount, so that's very good.
Right, yeah, agreed.
And it looks just from the photos here like the patient's very comfortable and they're not confined in any kind of tunnel or anything like that. And so it looks like it would be very comfortable for the patient, and I think that makes a big difference.
Absolutely. Yeah, you're absolutely right, it does. And then you can see from the picture, it's very, very open. The patient is basically moved into position on this robotic table that gives us a very high degree of accuracy. It's very, very flexible, allows us to put the patient in the precise position needed to deliver the treatment.
Very good.
And it's still very wide open, so it's not a confining experience at all.
Yeah, it looks like that. Well, very good. Thank you for the information.
Sure.
I want to tell folks that if you would like more information, if you call this number, you get the chance to talk to a nurse, or you can also visit our line. The online is scripps.org/proton. That's pretty easy to remember. There's the number on the screen, 858-549-7400. And you can get some more information here. Then I would assume that they would go through their primary care and insurance program and those kinds of things to get it all set up if you feel they're the right candidate. Am I right?
Yeah, well, the best thing anybody, if you have cancer or if somebody you know has cancer, the best thing they can do is talk to their doctor about it. Just call us directly as well.
Okay.
Because it's such a scarce resource, a rare facility, there being only 24 of them in the U.S., not all doctors may know about it.
Okay, so it's perfectly fine that if someone realizes they have a diagnosis of cancer, just to get on the phone to get the ball rolling, get some basic information.
Yeah, absolutely.
Very good.
Absolutely.
Fantastic. Doctor, thank you for coming on. We really appreciate it. Here's the number again, 858-549-7400 or scripps.org/proton. And I would shake his hand, but I have kind of a kind of cold today, as you probably have guessed, so I don't want to get anybody else sick. Right? I might need proton therapy. Who knows? Wouldn't that be great for colds? All right. Hey, good to meet you.
Likewise. Thanks, Ken.
We'll be right back.
Hope you feel better.
Oh, yeah, I will.